daily impact on families, community, it's devastating.
Still my heart, the moment I laid eyes on it.
I see it every single day. It has to stop.
How do you know?
It takes its toll on everyone. My office deals with the opioid epidemic daily. Across our country, opioids has made more grandparents become parents again because they're having to raise their grandchildren. It's record numbers. We see it right here at home. Opioids continue to ravage in the form of heroin, and now it's been essentially, we're seeing methamphetamine addiction rise, we're seeing fentanyl, we're seeing large amounts of overdoses across Kentucky. Kentucky's continuing to rise in overdose deaths annually. We're fitting right in with that trend.
And working with Sheriff Skeens on a daily basis, it really brought it firsthand. You know, you've seen the impact of it and the daily impact on families. We see it in our community when you look at the homeless population. You know, we look at that, and our homeless population, not because we've lost jobs in Garrard County, but it's on the opioid and the drug effects, and that's what we see. I mean, we see it more and more every day.
We realized we're not going to arrest our way out of this problem. We realized that, so we became very active in trying to recruit as many entities that can come in and help as possible. So the very first thing we did was we got Operation Unite to come in, working along with our physical court, to bring them in to host educational initiatives such as basketball camps, Unite clubs. They just done an Operation Unite on the move. So we've brought those entities in to help us because we're not going to do it alone.
We have put a lot of research into those programs to make sure that they're beneficial to the students. So in this research, we realized that the scare tactics that were previously used in other generations just do not work anymore with these adolescents. And they all have access to cellular devices where they can find all this misinformation on the internet and give them the option to use that information to make smart choices. The cigarette companies are now who own the vape companies and show them old advertisements of how they targeted pregnant women and used doctors, and now we know that that's just outrageous. It's almost like you see that click for them when you give them that knowledge, that they realize, oh, they're in it for the money and for lifelong users, and I'm their lifelong user.
As a physical court and as a sheriff's department, you know, we're looking at bringing resources in so people can come to us. If they need different aspects of it, we'll be there to lead them in the right direction as far as treatment. So we're trying to bring everybody in to tackle this and do what we need to do.
The second thing that we really got to realize is it's got to start with our youth. We have to become so involved with our youth and on the education side of things. And treatment is a positive thing, but you know, we still, if we can take them from never trying it, then you never have an addict. And that's where we have to get to on our education initiatives, is never try it, then you never have to worry about it.
In the schools, we have a lot of our staff that are in recovery and some that have lived experience with others that are in recovery or in active addiction, and these students really relate to that. Like, we are taking this conversation and making it common so they don't have to live in shame that someone they love may be in active addiction. They see it, it's opening this conversation. These students are turning in their vapes if they're vaping to our staff. They're asking how to get off the pathway of addiction because we have conversations about the pathway of addiction. They make flyers for their schools and hang them in the hallways without even being asked to. We're really changing the culture on what's acceptable in these conversations and making it public for them.
I grew up in a home that had substance abuse. And you know, coming from a single parent home as a result of that substance abuse, I've kind of personally felt some of the hurt, the consequences, some of the struggles that come along with that. And I'm so fortunate and blessed to have a mama that loved me and made sure she did every single thing to provide support for me. And unfortunately, not all of our kids have that same support structure at home. So it's imperative on the school system to take the place sometimes of these kids that might not have the support that I had growing up.
The big thing is we've joined forces with the school, the Sheriff's Department and the Fiscal Court to get out some educational programs to our students. We feel confident that if we reach on at a younger level and educate kids on this, that we see a greater impact.
We're excited to announce that in conjunction with the Garrard County Fiscal Court that a scholarship will be formed for students that are entering the counseling program to prevent opioid use. Our students desperately need support structures, support to kind of remove some of the tragic consequences of this opioid use. We're going to conduct an awareness campaign where we will be holding regular seminars, workshops, and assemblies to educate students about the dangers of opioid misuse. Curriculum integration will occur, especially in the content areas of health and science, where work will be centered around the pharmacological aspects of opioids, the physical and mental health consequences of misuse, and the social impacts of the opioid crisis. Counseling services will provide regular counseling sessions to students to address personal issues that could potentially lead to the misuse of drugs. Peer support groups will be formed to support our students in providing a safe and supportive space for our students to discuss their struggles, concerns, or experience related to drug use. Garrard County Schools will focus on parental engagement, which will hold regular meetings with our parents to discuss the signs of drug misuse and how to talk to their children about opioids. Garrard County Schools will provide resources to our parents and strategies to keep an open line of communication with their children. Garrard County Schools will train our counselors to provide the most updated and latest research regarding best practices regarding our opioid use prevention and treatment.
We're trying to hit all levels, all aspects of the community to bring them into one so we help everybody. And I think this would be a huge step for our community.
I am so excited that we're getting to bring back the DARE program to our schools. This is another initiative that we can hit our kids at the ground level, essentially at that middle school level when they're the most vulnerable. And the studies show that's when they do get that first offer to try some type of illegal substance.
It's going to be a long process. This is not something that's going to be fixed overnight. You know, our main thing is how do we reach these people? How do we help them to get help? And not only that, how do we get them back involved in the community to be a productive citizen instead of going down the path they're going? So that's our main focus. Together we can beat this.